My name is Inigo Montoya. You killed it, my brother. Prepare to die.
According to the World Health Organization, the president has sent them absolutely no evidence to support the notion that a novel coronavirus designated by scientists as SARS-CoV-2 was created in a laboratory. And we know the pandemic pathogen as COVID-19 only because we don't want to get the wrong idea. So we must conclude, therefore, that the Centers for Disease Control had posted on their timeline for 3 months that the first infection case in the continental United States occurred on January 14th, 2020, just 14 days after the Chinese government admitted that they had a public health problem in the form of a, quote, novel coronavirus, unquote. They actually made a mistake. January 14th looks so much like February 25th that anyone could have made that mistake. According to the World Health Organization, the president has sent them absolutely no evidence to support the notion that a novel coronavirus, designated by scientists as SARS-CoV-2, was created in a laboratory, and we enforce social distancing to keep people far apart, to avoid coughing, sneezing, and talking because their mouths might infect us even if we are standing behind them. So, we must conclude, therefore, that when Dr. Norman Oliver, Health Commissioner for the Virginia Department of Health, had reported that the first infection case in Virginia had occurred on February 28th, he too was simply mistaken. To err is human, because everyone knows that February 28th and March 7th are practically twins. Like SARS and SARS-CoV-2, the virus that has over a 90% nucleic acid profile match with the other coronavirus that zoonotically evolved from a bat in China, albeit a totally different bat, and without the human respiratory cell-specific spikes to cling like Velcro and penetrate deep into human cells for maximum damage, and enhanced, new improved in lethality by HIV inserts to degrade the human immune system. According to the World Health Organization, the president has sent them absolutely no evidence to support the notion that a novel coronavirus designated by scientists as SARS-CoV-2 was created in a laboratory. And we can wear face coverings, medical grade or not, to prevent infecting others and to protect ourselves. So we must conclude, therefore, that when Dr. Ralph Northam goes to visit prisoners in prisons to show them that he is totally safe when he puts on his non-medical mask, then we are safe without the medical protection that a public health professional would wear in a hazardous environment. Even if the National Institute for Health actually performed an aerosol study in 2010 to conclude that any household fabrics from a Hanes sweatshirt to a bandana may stop a virus only 5% of the time. According to the World Health Organization, the president has sent them absolutely no evidence to support the notion that a novel coronavirus, designated by scientists as SARS-CoV-2, was created in a laboratory. And just ask Dr. Norman Oliver, Virginia Health Commissioner. It is very common for a doctor not to list exactly where he obtained his undergraduate degree on his resume. Perhaps he forgot. So we must conclude, therefore, that it is very common in epidemiology for a biological particle that relies on a human host to transport itself to new locations to only choose the people who escaped Wuhan during the lockdowns that happened to avoid the top 15 destinations from the airport. missing somehow Hong Kong and Bangkok, wonderful places to go in Asia, and rather go to Iran and also South Korea. A biological particle without a brain that tended to select in large numbers only primarily Americans aboard the cruise ship Princess Diamond, which originated in Yokohama, Japan, resulting in 26.9% of Americans being affected, the highest infection rate aboard a 2,000 passenger luxury ship. An unintelligent microbe that prefers to arrive in the United States via Seattle from the west rather than Los Angeles like most people, and that prefers to arrive by the east through Boston rather than New York City. Perhaps it is possible and perfectly natural to a scientist. According to the World Health Organization, the president has sent them absolutely no evidence to support the notion that a novel coronavirus designated by scientists as SARS-CoV-2 was created in a laboratory. And the Centers for Disease Control always disregards their common human coronavirus sheets when a novel coronavirus arrives to build an infection model based upon an entirely different common virus like influenza instead. So we must conclude, therefore, that even though the World Health Organization explained in great detail in March that lockdown policies will definitely kill families and others exposed to long-term exposures in close quarters, as in nursing homes, just like the CDC found aboard the cruise ship Princess Diamond, when the Governor Northam tells us to stay home and stay inside and not go out, we should do so. And when he says to wear a mask that may only stop a virus 5% of the time, we should only follow orders. Democrats, 9 out of 10 doctors recommend.
In a game of chance, sometimes you have to give faith a try. The law of large numbers dictates that if you repeat a random exercise a sufficient number of times, you will always get the desired result. My name is Inigo Montoya. You killed it, my brother. Prepare to die.
This advertisement was authorized by Mike Webb.